artificial intelligence has some dangerous connotations, right? So I like to reframe it not as AI, but IA, intelligence augmentation. And I think we're going to see IA infuse all elements of our life. It's going to infuse everything from a physician standpoint about how I do a smarter workup and diagnosis. And when I figure out a condition you might have, I'll be able to do a much smarter, more cost-effective, and more timely therapy. Given how many mistakes we have, how many misdiagnoses we do, how big a problem medical mistakes are, I think AI or IA can play a really impactful role. It'll be something you have embedded in all your smart devices that will help track your health and give you empowerment as a consumer and a patient to take care of your own health and that of your family. And it's already starting to happen with Watson having gone to medical school. We can access the API for Watson with our mobile devices. They're partnering with the Apples of the world and the Medtronics. And I think it really has the opportunity to shift healthcare from the practice of medicine to the real science of medicine. So robotic surgery, even remotely, isn't science fiction. Companies like Intuitive Surgical have had advanced surgical robots for over a decade. They require often the surgeon to be there in the booth doing the procedure. It's even been demonstrated that that can happen across the planet. The real opportunity as we kind of fuse AI, imaging, sensors, is in some cases for some of these robotics to become semi-autonomous, to de-skill advanced surgery so that in a remote village with the right robotics, maybe a local country doctor can facilitate and enable more of a complex surgery that could never happen based on where the patient may be, whether it's on space station or Mars or in remote India, for example. So robotics blended with AI, blended with analytics and smart imagination, I think can really transform healthcare.
Researchers at University Hospital Zurich painstakingly make up biopsy slides, up to 50 for each patient, for the pathologist to examine for signs of prostate cancer. The pathologist takes around an hour and a half per patient, a task IBM's Watson supercomputer is now doing in fractions of a second.
My time is also worth something. If I sit here 1.5 hours looking at slides, screening all these slides, instead of just signing out the 2 or 3 positive ones and taking into account that there may be a 0.1% error rate, this will pay off because I can do in 1.5 hours at the end 5 patients.
The hospital's archive of biopsy images is now being slowly fed into Watson, a process that will take years, but may one day mean pathologists don't have to view slides through a microscope at all. Diagnosis is not the only area benefiting from AI. The technology's helping this University of Sheffield team design a new drug that could slow down the progress of motor neurone disease. The system, built by British startup Benevolent AI, is identifying new areas for further exploitation far faster than a person could ever hope to.
Benevolent basically use their artificial intelligence systems to scan the whole medical and biomedical literature. It's not really easy for us to stay on top of the millions of publications that come out every year. So they can interrogate that information using artificial intelligence, come up with ideas for new drugs that might be used, say, for example, in a completely different disease, but may be applicable in motor neuron disease. So that's the real benefit of their system, is the kind of novel ideas that they come up with.
Benevolent AI has raised $100 million to develop its system and help revolutionize the pharmaceutical industry.
The role of artificial intelligence in the future of healthcare is really interesting and for physicians a little bit scary and threatening. If you're a physician like me and you trained for 7, 8, 10 years to learn your craft, the idea that a computer might come in and take over for you, a lot of us have to have ambivalent feelings about that. If you watched Watson beat the Jeopardy champions, I don't think you could watch that without wondering what profession is safe. And we've seen profession after profession be taken over by computers. I think many of us had a bias that medicine's too hard, too complex, it's impossible. But if you watch Watson, you had to be impressed. I spent some time with the IBM people and came to know what Watson does. And I came away quite impressed, but also feeling like the jobs of doctors are pretty safe for a while. The problem with the analogy between Jeopardy and medicine is that in Jeopardy, you were feeding Watson 3 to 5 salient points embedded in a Jeopardy question, and Watson's awfully good at solving those. But when I see a patient, I'm often collecting 200 pieces of data on the patient, everything from the patient's past medical history to their blood pressure to the look of anxiety in their eyes or the sweat on their brow. distilling those 200 pieces of data into those 5 salient ones turns out to be an enormously complicated cognitive act. Right now, even Watson is not able to bypass the doctor's skill in doing that. Where I think artificial intelligence will probably begin to take over is in fields that are about visual pattern recognition, where the computers are extraordinarily good. For the rest of medicine, forgetting about the empathy part, where I think we really do need people, at least for now, but for diagnosis, for the rest of medicine, I think what we'll see is computers and people working side by side, and the experience in other industries is that